So I'm going to go through a slideshow and talk about preventing falls and helpful tips. Now, of course, people of any age can fall, all the way from young children to older adults, but the consequences are more devastating for people over 65 because they tend to get injured and break bones. You know, when you're a child, if you fall, maybe you bounce a few times and you get up and you keep going. So we're going to focus on falls in older adults, and I'll share some helpful tips throughout this presentation on action steps that you can take to prevent falls. So before we start, I want you to just think to yourself, are you listening to this seminar for your own purposes, or are you listening on behalf of a loved one? And whoever you're listening to this for, kind of keep that person in mind as we go through, whether that's yourself or a loved one. And if you have questions, you're welcome to type them into the chat box, and we'll look at those at the end. Or you can save your question for the end and you can ask on camera. So we'll have two options at the end for questions. So I want to first introduce you to a local group that I'm part of called the San Diego Fall Prevention Task Force. So how many of you have heard of that? San Diego Fall Prevention Task Force. Have you heard of that group? That is a local group of both public health employees of San Diego County and private healthcare providers like myself. We work collaboratively with a shared mission to reduce falls and their devastating consequences for older adults in San Diego. If you want to learn more, you can check out our website, sandiegofallprevention.org. You can also tune in. We have a meeting, monthly meeting next Tuesday. I believe that's March 8th from 1 to 2 p.m. on Zoom. And we welcome the public to join our meetings where we talk about how we're going to work in the community to get the word out with the strategies and action steps that I'm sharing with you today. So this is the content that we've put together. These slides are from the Fall Prevention Task Force. And this is what we want to share with the residents of San Diego to help reduce falls and their devastating consequences. So to start off this topic, I'm going to share 3 common myths, and I'll explain why they are not true. The first myth that a lot of people think is that muscle strength and flexibility cannot be regained. So with normal aging, muscles tend to atrophy, they lose mass, and they lose strength. That's just normal aging of muscle. But it can be regained with exercise, and that's why it's a myth. The second myth is that if people stay home, they can avoid falling. And we see this commonly when mom or dad starts to fall and their child says, well, mom, just stop going to the grocery store. Dad, stop going golfing. Just stay home. I'll have your groceries delivered and you can just not go out and then you won't fall anymore. And that's a common myth that we hear. But the reality is when we look at statistics, most people fall while walking on a level surface, slipping or tripping in their own home. So that is where most people fall. A very small percentage of people fall off things like ladders. We're looking at maybe less than 10% of falls in older adults are from risk-taking behavior, like climbing a ladder to take or something, or replace a light bulb outside. Most falls in older adults happen in the home on a level surface, and that's why staying home will not necessarily prevent falling. The third myth is that falls are a normal part of aging. And although falls are common, as people get older, they become more common, it's not necessarily a normal part of aging. And therefore, it's not inevitable that everyone will fall. And that's why we're talking about this today, so you can learn about preventing falls. Statistically, about 1 in 4 older adults report falling each year. Now, this statistic is from health information surveys, meaning health surveyors call people over 65 on the phone and interview them about their health through a phone survey. This is not necessarily people who seek medical care go to urgent care, or go to the emergency room. This is just in a pool of older adults that were called at home to be interviewed. About 25% reported falling within the last year. Now, of those, 20 to 30% had severe or moderate injuries that can prevent them from returning home or living alone ever again. So you're looking at a percentage of people who fall will not be able to return home because of severe injuries like brain injuries, broken hips, etc. And then you do have a percentage of people who end up at urgent care with things like scrapes on their elbows, skinned knees, maybe a bump on their head, and they just need some wound care. But it's still very painful, but they don't need to go to the emergency room necessarily. And then you have a group of people out of that sample, of course, that fall, but they never tell anyone, they never report it because they didn't get injured and they don't need any medical care. So we're looking at that group of people is the possible outcome of the fall. And older adults who have one fall are at a higher risk of falling again. And the statistic on that is about 50% of people who fall will fall again within 6 months. Falls are the #1 cause of hip fracture in older adults, and they're the #1 reason that older adults have to move into a nursing home, which everyone I talk to, we all want to avoid. So that's why we're focusing on this topic. This is a very important topic for quality of life in aging and for preventing pain and suffering. So we're going to go through 4 categories of action steps that you can take to prevent falls. Now, preventing falls is multifactorial, meaning the more things you do to prevent falls, the better the result. And it's an exponential increase in the reduction of fall risk, the more things we do. So the more steps and actions we take to prevent falls, the exponential impact it has on reducing the risk of falls. And that's because a lot of the things we're going to talk about are related to each other. So the first category we're going to cover is speaking up. The second category is keep moving. The third is check your eyes. And the fourth is make your home safer. So we'll start here with speaking up. One of the things that causes falls in older adults is chronic health conditions, and another is medications. So when people have chronic conditions, certain chronic conditions, it can increase their risk of falling. I want you to think for a moment of a chronic condition that you think could increase the risk of falling. I'll give you a second to think about that. Now I'll give some examples. For example, diabetes. If the blood sugar is not being well managed, then a low blood sugar spell can cause dizziness, and even high blood sugar can cause dizziness. Blood pressure, for example, blood pressure too high or too low can cause dizziness. Sometimes people with blood pressure problems may get up quickly and feel like they're going to faint. Irregular heartbeats can cause dizziness, cause falls. Parkinson's, a stroke, muscle weakness, all these kind of things. Even arthritis, pain in the knees or the hips can alter the way people walk and cause them to fall. So chronic health conditions can cause falls, and then medications can cause falls as a side effect. So even one medication, if you're only on one medication, that could possibly contribute to falls if the side effects are blurry vision, drowsiness, dizziness, or muscle weakness. Now, medications can also interact with each other, and they can interact with alcohol. So these are all the ways that chronic health conditions and medications contribute to falls. What you can do about it is speak up and talk to your doctor. Now, this is where the point needs to be made that it's very important to have a primary care provider that you really trust, whether that's a medical doctor or a nurse practitioner or a physician assistant. We'll call that your primary care provider, whoever that is. It needs to be someone that you feel will listen to you, will respond to you in a timely fashion, and will educate you on what questions you have and look at things really analytically. So one thing I'll mention here that just occurred to me is UCSD actually has a really nice concierge medicine program where the doctors spend more time interacting with their patients than an average medical doctor would, because that's how they've set it up. They provide a very high level of customer service. And I know some patients on Medicare who have joined the concierge medicine clinic at UCSD, and they all rave about what great customer service they're getting and what great care. That's a good option for some people, even though it does cost extra, because in medicine today, we're finding that the number of patients exceeds the number of healthcare providers. So there is a shortage right now of healthcare providers, and people are not getting great customer service in general at the doctor these days. That seems to be a common complaint. So here are some examples of things you can talk about with your primary care provider. Like I said, that could be a doctor, that could be a nurse practitioner, or it could be a physician assistant, whoever is your primary care provider. You can discuss, you can actually schedule an appointment for an annual exam, and it can be called, under Medicare, they have something called a wellness exam, an annual wellness exam. It's kind of like getting a physical, and they check you for the risk of many things that are common in older adults, one of them being falls. And so you can talk to your doctor at an annual visit, or you can schedule a special visit. If you fall in or you're afraid of falling, you can schedule an appointment specifically to address the risk of falls, because we want to prevent falling so we can prevent injuries. So you can ask your primary care provider, can my medication be contributing to my balance problems or falls, and have them look through and look at the side effects of medicines you're on, especially if you've lost weight recently. If you've lost over 10% or more of your body weight, then some of your medications may need to be adjusted in terms of the dosage, because medications are sometimes prescribed based on body weight. So if you've had a significant weight loss, you should talk to your doctor about reviewing your medications. And if you're suffering with balance problems, falls, or dizziness, you should ask your primary care provider to look at your medications regarding that as well. And they can do an interaction check to see if something you're taking is interacting. You want to also tell them what supplements you're taking, because, for example, I've met people who are on Coumadin, which is a prescription blood thinner, and then they're also taking aspirin, which is an over-the-counter blood thinner, and then their kids have them taking garlic pills for their immune system or something, and garlic is a blood thinner. So then you have people on 3 blood thinners, 1 prescription, 1 over-the-counter, and 1 herbal supplement, and they don't realize these are all working together and maybe thinning their blood too much, which can be dangerous if they fall and they start bleeding. So you want to make sure to talk to your provider about over-the-counter medications you're taking and herbal supplements as well. Then you can talk to your primary care provider about your current health. I'm on number 2 here on this slide. Are any of your current medical conditions affecting your risk of falling, and what do you need to do about it? For example, if you have macular degeneration or glaucoma, some kind of visual issue, maybe you need to be closely followed by an ophthalmologist. Maybe you need to use eye drops or certain medications to manage that condition. If you're suffering from depression or anxiety, we know that that increases the risk of falls. You may need mental health intervention, for example, cardiac, neurological, all these areas of health can affect the fall risk. And so they may need to be managed by a specialist, and your primary care provider can help you figure that out. Number 3 here, you can ask your primary care provider if you benefit from a referral, not just to a medical specialist, but maybe to a physical therapist or an occupational therapist. Now, physical therapists are going to help with things like getting out of bed, walking around, getting in and out of your car, walking on uneven surfaces and things like that, making sure you're safe. And occupational therapists help with things like getting dressed, cooking a meal, getting in and out of the shower, just things that are activities of daily living that may challenge your balance, like reaching into the closet to get your clothes, things like that. So And some people need both physical therapy and occupational therapy, but your doctor would, or your primary care provider would be the one to initiate that referral if you want your insurance to pay for that. Now, the other thing your primary care provider may check you for is doing some blood work to make sure that your vitamins are good, your vitamin D, your vitamin B12, your calcium, because sometimes if your vitamin levels are too high or too low, that can throw you off. And so they may suggest supplementing, especially if it's too low. And then they may suggest what type of exercise you can do to gain your muscle strength. And if they're not sure, then you could ask for a referral to a physical therapist, because that's what we do, is design exercise programs for people with specific medical or surgical histories that make them uncertain how to safely exercise. The other thing your primary care provider will do is a fall risk assessment. This is typically part of the annual Medicare exam. And they usually have 3 questions they have to answer in their Medicare documentation, which are: have you fallen in the past year? Do you feel unsteady when you're standing up or walking? And are you worried about falling? Now, I would encourage you to answer these questions honestly. Some people try to blow it off or minimize or hide if they've fallen, or if they're afraid of falling, they try to just say, oh, I'm not going to say anything. I'm going to keep it a secret. I don't want anyone to know. But the truth is that telling your primary care provider accurately the answers can initiate the professional support you might need to prevent a dangerous fall. So that's the speaking up category. Now, the next category we're going to talk about and go over some helpful tips is keep moving. So one of the problems that people face is when they retire, they kind of figure they'll be able to finally rest, finally relax, and maybe they become sedentary, so they're not as active. And one of the things I say frequently that people quote back to me when I meet them sometimes is, if you don't schedule your retirement around your physical fitness, you will end up scheduling it around all your doctor's appointments. Okay, so it's kind of one or the other. So you want to get a plan for your physical fitness, and you want to stick to it. And don't let anyone cause you to cancel your workout or skip your fitness class or, anything like that. You want to be really strict with your exercise program and not compromise whatever you come up with for yourself. We'll talk about some ideas in a minute here. The second problem is people are afraid of falling, fear of falling, so therefore they don't want to exercise, they don't want to move around, they don't want to leave the house, and that stops them from moving. So it's either a lifestyle choice of more sedentary lifestyle, or it can be a fear of moving or an uncertainty about the best way to exercise, especially if you have pain or you have a medical condition that limits you. So in terms of helpful tips here to stay active and keep moving, first we need to look at footwear. So you can see the far left of my screen, the high heels really unfortunately have to go. They are associated with spraining ankles, twisting ankles, and falling down, and the bottom can be slick. So unfortunately, the heels are really not practical in older adults. And then for men, likewise, when you go out, say you go to an opera or you go to the theater and you get dressed up, the men's dress shoes tend to be slick on the bottom. So you really need to be careful not to wear shoes with a slick bottom, and the ladies to not wear the heels. Unfortunately, I know that's a tough transition to make, but I always tell my patients, you don't look very good in a hospital gown, so consider that the potential outcome of going out in your heels if you happen to fall. It's a good kind of a wake-up call there. And then these boots in the middle, you can see that the sole is really thick. And the reason that's not good is because you actually need to be able to feel the firmness of the ground somewhat through the sole of your shoe. So that's called, in physics, that's called the ground reaction force. And under normal conditions, the feeling of the firmness of the ground on the bottom of your feet is the primary thing your brain uses to create your balance when you're up, standing up and walking. So So if you can't feel the ground through your shoes, and I'm not saying feel the ground completely, but you should at least feel the bottom of your shoe has pressure on it, which is you standing on the ground. If you can't feel that because the sole of your shoe is so thick, like these boots, then that's like walking on marshmallows or like walking on a mattress, and it's not giving you the feedback you need in the skin of your feet to balance yourself. So we don't want shoes that are too thick or too clunky or too heavy. And then if we look all the way to the side here, the best type of shoes are the ones that are gonna securely fasten to your feet and have a thin, non-skid sole. Now, in regards to flip-flops, if you like flip-flops and sandals, you just want to get a pair that has a strap around the heel and securely fastens onto your feet. So they have some that have a Velcro strap that goes around the heel. Those are better than the flip-flops or sandals that have an open heel, because those could actually fall off your feet. And in regards to slippers, like house shoes, just get some that have a heel on them again, so you can slide your feet in and firmly pull the slipper around your heel instead of slip-ons. We want to avoid slip-on slippers and slip-on flip-flops, because those can come off your feet more easily while you're walking. Okay, and then the next tip and helpful tip regarding moving is with regards to the mode of exercise, like what actually you'll be doing, whether you'll be going to water aerobics or biking or swimming or, gardening, housekeeping, it's very clear that you have to do something you enjoy. And if you don't enjoy it, you're not going to do it. So the mode of exercise, the most important thing is to find something you enjoy. Now, whether that's a group activity or having a workout buddy or doing maybe videos at home yourself. Some people like to do partner dancing, line dancing, square dancing. A new thing people are doing more is pickleball. So there, even ping pong, table tennis, because it's got a lot of side to side action with your feet. So there's different modes of exercise. Maybe you want to take a group fitness class. Maybe you want to get an exercise bike for your house or meet a friend and go for a walk. It doesn't matter necessarily what you do, as long as you do it regularly and it addresses different components of fitness, such as strengthening, balance, endurance, and flexibility. So you want to try to include those things in your workout to stay fit. And you can see here, this woman in the picture, she's sitting in a wheelchair, but she's gardening, and even seated exercise has been shown to reduce the risk of falling for older adults. So it's important to find something you enjoy, get it on your schedule, and don't let anything cause you to cancel, and stick with it. Now, if you're not sure how to exercise, because say you just had a heart surgery, or you just had a knee replacement, or you have back pain, or so, you have arthritis in your hands or something, and you're just saying, I don't know how to exercise, or maybe you've never exercised before in your life, and that was fine up until you passed 65 and your muscles started to wither away with normal aging, and now you have to exercise if you don't want to shrink all your muscles. So people that have never exercised before in their life sometimes have to start exercising after 65, and they don't know what to do. So whether you aren't sure what to do for whatever reason, you can work with a physical therapist. So physical therapists are healthcare professionals that are licensed by the state of California, and they design exercise programs that are safe based on your medical history, your surgical history, your pain issues, or whatever you have going on. And they can get you started on that and train you on how to do it. Now, if your doctor or your healthcare provider makes a referral to physical therapy, then typically it's going to be covered by your insurance. You can receive physical therapy at a clinic, like drive to a clinic, for example. That's called outpatient physical therapy. If you end up in the hospital or a nursing home for some reason, you would receive physical therapy there to get you strong enough to go back home, hopefully. And then you can also receive physical therapy through what's called home health care. So home health care exists under Medicare Part A for homebound patients, meaning people that either can't get out of the house to go to the clinic, or they've just come home from the hospital and they're transitioning back home from a hospital or a nursing home. And that's covered by Medicare Part A, as long as it's referred by a doctor. And you don't have to go in the hospital or the nursing home before receiving home health physical therapy under Medicare Part A. Even people that have had a decline in their mobility or a recent fall can get a referral from the primary care provider to do home health physical therapy, and it's covered under Medicare Part A to prevent a fall, to prevent a hospitalization from a fall. Then you can also receive physical therapy under Medicare Part B, which can be given to you at a clinic or at your home, depending on which company you hire to do that. So some companies provide physical therapy in the home under Medicare Part B, and some you have to go to their location to receive physical therapy under Medicare Part B. And then if you have a managed Medicare program or a Medicare Advantage program, you have to figure out exactly what that program will authorize for your physical therapy and go with whatever they will allow. So I want to mention to you, if you've gone through traditional physical therapy and you're still falling, so you've done strengthening and, stretching and exercise and, basic balance training, and you're still off balance or you're still afraid of falling, or if you're having dizziness or vertigo, then I suggest for you to consult with what's called a vestibular physical therapist. Now, the vestibular system is our inner ear balance center, and this is a specialty within physical therapy. Similar to within medicine, how you have a primary care provider, that would be like a general physical therapist, and then within medicine, you have a neurologist, which is a specialty provider that focuses on the brain and the nerves. Well, in physical therapy, we have specialists called vestibular physical therapists that specialize in balance, preventing falls, dizziness, and vertigo. And they have more training than an average physical therapist. So that's what I do. I was a general physical therapist from 2002 to 2006 for 4 years. And then in February of 2006, I began training, and I've been specializing now in this vestibular physical therapy since then. So probably 16 years I've been doing this. And that's why now at this point in my career, I only take patients with dizziness, vertigo, balance problems, or falls, because that's a specialty that I have. Whereas if someone calls me and they say like, oh, I just had back surgery and I need physical therapy, I refer them to one of my colleagues that's a general physical therapist, because any physical therapist should be able to do that kind of care. Whereas vestibular physical therapy is a specialty. So the difference is that vestibular physical therapists are going to do what's called a root cause analysis. So that's what I specialize in doing. So we're going to look at, why are you falling? Why are you afraid of falling? And why are you off balance? Some examples: fear of falling can sometimes be from a new anxiety disorder or agoraphobia or something like that. It would be a psychological issue that's come up. Sometimes people have developed what's called neuropathy in their feet. In fact, I just saw a new patient yesterday who's fallen and hit his head, and he didn't know why he had fallen. And when I assessed him, did a comprehensive assessment like this with hands-on checking different things, I found that he couldn't feel his feet. I tested him 10 places on his feet with his eyes closed, and he didn't feel a single one. So he had neuropathy in his feet. And I explained to him that's why he's so off balance, that's why he's falling. But he had already gone to a chiropractor and done a whole course of care, and it hadn't helped, and no one had identified the root cause. So that's sort of the key thing with a vestibular physical therapist, is we're really looking for root cause. Just why is this happening to you, so we can figure out a targeted treatment plan. The other difference is a vestibular physical therapist, this is sort of different from a traditional healthcare provider. We do a hands-on exam, whereas a lot of healthcare providers rely on diagnostic testing. So they might send you for MRIs and X-rays and all kinds of tests, lab work, and then they analyze the results. that's helpful. That's extremely helpful for diagnostics, but very frequently nothing shows up on those tests. The lab work is fine, the MRI looks fine, the x-rays look fine, and they still can't tell you why are you falling. And so that's where a vestibular physical therapy evaluation is very helpful, because we are using hands-on assessment, which I have to say, I think is pretty rare in healthcare these days. And we're looking for root causes with a physical exam, which is actually highly sensitive to figure out what the problems are. So if you want to look for a vestibular physical therapist, you can go to a website called vestibular.org. And this is a nonprofit organization that I do a lot of outreach for. And they're advocates for people with dizziness, vertigo, balance problems, and falls to find the right healthcare provider with this type of specialty. Because you can go around and around to traditional healthcare providers forever and not get any answers or relief. But if you find a vestibular provider, chances are you'll get more information on the root cause and what to do about it. So you would go to vestibular.org and then click on healthcare provider directory, and then you can type in your zip code or your city and state and hit enter, and they'll pull up all the different providers that are specializing in this area. And like I mentioned, this is my specialty as well, but I don't take health insurance. So I always encourage people to check on here, look for someone who takes their insurance as plan A, and then they can come to me if they don't get results with that. So the third category we're going to look at today, we've covered speaking up and we've covered keep on moving. And now we're going to look at vision. So we have three issues here with vision. One is normal aging of the eyes. When people get older, one example of normal aging is they need more light to see the same things. So you may notice that it's harder to see. You need to turn on more lights. You need to install more lights. Also, they're more sensitive to glare. So you may need to put up more glare protectors in front of your windows. And if you have shiny floors or marble counters, that may affect your vision more. Then you have actual eye diseases in older adults, which are cataracts, glaucoma, macular degeneration, and diabetic retinopathy are more common in people over 65. So in addition to normal changes with aging that affect everybody, older adults also have more eye diseases than younger people. And then you have the issue with glasses. So for example, bifocals, trifocals, and progressive lenses, while they may be convenient, are associated with more falls, especially on curbs, steps, ramps, and inclines, because people accidentally look down through the reading portion of their lens and their depth perception is off, and they may step and miss the curb or miss the step and then fall. So I've had people that fall on steps, curbs, or ramps or inclines shortly after getting bifocals, trifocals, or progressive lenses. So for some people, that type of glasses is just not a good option. So those are really the three things we look at here with vision: normal aging, eye diseases, and appropriate lenses. So you want to get your eyes checked. Typically, we recommend people over 65 get their vision checked once a year. That's by an optometrist to make sure your glasses are correct. Now, if you have an eye disease, then you may need to also see an ophthalmologist and get medications or eye drops and get checked for that. Cataract surgery the first eye cataract surgery has been shown to reduce the risk of falling for older adults. And regarding normal changes to the eyes with aging, there's nothing we can really do about that except eat healthy and stay hydrated. But just be aware that as you get older, you may need to put more lighting in your house, and you may need to reduce the glare, take measures to reduce the glare. So now we're going to look at making the home safer. We've talked about speaking up, we've talked about keep moving, and we've talked about get your eyes checked. Now, the fourth category here is environmental hazards and how we can make the home more safe. So this is just 4 examples we'll look at here. The top left side of my screen is low lighting. So we know that a lot of older adults rely on their vision for balance. And as I mentioned, with normal aging of the eyes, you typically need more light to see the same things you used to see with less light. So this is an example of low lighting situation that's not good. In this case, we would want to turn on the lights or perhaps install more lighting in this dark room. The bottom left side here of the screen shows a puddle on the floor. Now this could be from a spill, this could be from a leak. Sometimes if people are incontinent, they may stand up and urinate on the floor on their way to the bathroom, for example. But regardless of how this got here, we want to make sure to avoid hazards like this. If you see a spill or water on the floor, step around it or make sure it's cleaned up right away. Slick floors like this can definitely cause falls. And that also applies if you have a wood floor or some kind of floor that gets waxed for the treatment. Sometimes people have someone come in and wax their floor, or they wax their floor themselves. That type of floor can be really slick, and we need to be careful about that. The third example here, kind of in the middle of the screen, is clutter. What happens a lot of times is people downsize in retirement. They move out of their house into a smaller apartment or condo or retirement unit, and they want to keep all their stuff. So they won't let go of all their furniture and all their stuff. And that's understandable, of course. But when it's too cluttered and you can't walk around without turning sideways and shimmying between things, then that's not safe. So you need to make sure all the walkways are free of clutter, and you can walk through even with the width of a walker, in case, the unfortunate thing would happen, which would be that you would, fall or get injured and need to use a walker at some point. You don't want that to be the time that you start rearranging the furniture in your house. So you want the walkways to be wide enough that you or your friend or anyone that needs to use a walker could get around safely, with the walkways being the width of a walker when you set up your house. And then the final thing here at the bottom right is throw rugs. A lot of people trip on throw rugs. So some solutions are to either get rid of them altogether, which a lot of people don't like because it doesn't go with the decor of their house. They want to keep the throw rugs. So you could stick it down to the ground with double-sided tape along the edges of the rug. You can tape it down with double-sided tape. You can also put a non-skid mat between the rug and the floor to kind of keep it stuck on the ground, so at least it won't slip around. And then you can buy rugs, like a bath mat, for example, that has a non-skid surface on the bottom. So those are some solutions for tripping on throw rugs. And this right here is the home safety checklist that we have for the Fall Prevention Task Force. This is a lot more details about making your home safer that we don't have time to go into today, but we will, Susan will send this out to you all. So you can take a look at this and just check around your house and make sure that in each room and in each category, you've taken some action steps to make your home safer, to prevent your home environment from causing falls. Here are some examples of tools you may purchase at some point to help you. In the shower, the grab bars, the tub bench, or the shower chair. And if you do need a tub bench or a shower chair, you would need to get a handheld shower hose, which is in the upper right corner, so that you can control the flow of the water on yourself while you're seated. The thing with the grab bars are that they have bolts that bolt into the studs versus a towel rack, which a lot of people default to grabbing their towel rack. But the problem is the towel rack has short screws, usually less than an inch, and that's just in the drywall. So if you put any weight on your towel rack, it's going to come out of the wall at the wrong moment and you could fall. So you want to get grab bars that are bolted into the studs, and they have decorative grab bars now that look like towel racks. They even have one I saw recently that looks like a toilet paper holder. So you could put it near your toilet to help you get up and down, and it holds your toilet paper but it's bolted into the studs. So it's strong enough that you can pull up on it or hold it as you're lowering down, and nobody even knows you have grab bars because they're the decorative kind. The other thing I'll mention here is assistive devices. Some people do end up needing a walker or a cane for balance, even for a short period of time. Like my grandpa was starting to decline and he was having trouble walking. So I told him, Grandpa, just use the walker to do like 100 steps a day to get your strength up. And then once you get your strength up, you won't need the walker anymore. But to make that transition back to getting in shape, he needed to use the walker as a tool to be safe. So something to think about. Some people just hang a walker or a cane in their house in the closet and just have it as needed if they're having a bad day. And then these emergency alert systems are really good, so that if someone has a fall, they can call for help right away. You can come up with whatever works for you, but make sure you have a plan to call for help in the event that you do have a fall. And typically when people have this type of system, they want to get a lockbox from like Home Depot or one of the home stores and put a copy of your door key, your front door key, in the lockbox, and give the code, the lockbox code, to the emergency alert company or to your local fire department, so that if they come to rescue you, they don't have to break your door down. And you press the button, I've fallen and I can't get up. And then they activate the emergency response system, and either the company that you hired for your emergency alert needs to have the code for your lockbox, or the fire department in your area does. And then they come, they press the buttons, they get your key, they open the door, they get you up, and either you go to the hospital or you don't, but either way, they didn't break down your door or break your window, which a lot of times paramedics have to do to get to older people who have fallen if they can't get in the house. So we've talked about speaking up, we've talked about keep moving, we've talked about check your vision and make your home safer. Now I want to share with you a couple local resources. We do have community programs for free in San Diego, and you can learn about them at healthierlivingsd.org. We have programs that are evidence-based for managing chronic health conditions. We have some that are just specifically for managing diabetes, for managing chronic pain, and then any chronic health condition. And that will help if you have a chronic health condition that you think is increasing your risk of falling, but your primary care provider doesn't have time to educate you on everything regarding that condition, which is common. So you can sign up for one of those free programs and work with a health coach to manage your chronic health conditions. We also have a program at San Diego that's free called the Feeling Fit Club. And you can see this picture on the right here of these three ladies in the purple shirts. You can do it standing or seated, and it is shown on local access television, I believe at 8 a.m., 1 p.m., and 4 p.m., Monday through Friday, whatever the local channel is on the TV service that you have. Or you can contact the county through this website, and they'll mail you some DVDs and a fitness band, an exercise band to use at home. So just to review, we've gone over the 4 action categories, and we've covered a lot of helpful tips in each category. That would be speak up, keep moving, check your eyes, and make your home safer. I want to let you know that I do have additional free helpful information online. I did 3 lectures at the UCSD Stein Center. One of them is on preventing falls. It's called Taking Steps to Prevent Falls. That was an older presentation, probably about 6 years ago at this point. And then the one that has over 2 million views is the one right here in the middle from 2017. And if you look online, it's called Dizziness and Vertigo, Research on Aging Part 1 is what it's called on YouTube. So you can look it up, Part 1. But if you go on the UCTV website, it doesn't say Part 1. It just says the title here on the slide. And then I do have a lecture, Dizziness and Vertigo Part 2, not quite as popular, only has maybe close to 100,000 views. I'm not sure exactly at this point, but the one in the middle, Part 1, has over 2 million views and is very popular. You can find it by Googling the word dizziness and YouTube, or you can go on the UCTV website and find it there by typing in the title. So if you want to contact me directly, you're welcome to use the contact form on my website, which is betterbalanceinlife.com. I do have an office in Encinitas where I provide patient care. And then I have a team of physical therapists who make house calls throughout the county. So we do screen everybody that wants to work with us very thoroughly, because we don't take health insurance. And if we think there's an option for someone to see another provider that would be covered by their health insurance, we're going to usually recommend that first, just to save you some money. But if people either exhaust those benefits or they want a second opinion or something, then we do work with people, and you can learn about that at betterbalanceinlife.com. Okay, now we're going to have time for questions.